أهلا وسهلا بكم. هنتكلم مع بعض عن موضوع ال AED جهاز الصدمات الكهربي الذاتي. تمام. جهاز الصدمات ده اللي هو الأوتوميتد اكسترنال ديفايبريليتور. جهاز ال AED ده موجود في المصانع، في المستشفيات، برضه موجود في أي مكان، في المدارس موجود، ممكن يبقى موجود في أي أماكن العمل. تمام. فده بيستخدمه النون ميديكال تيم، وبيستخدمه بالطريقة اللي احنا هنشوفها مع بعض دي في الفيديو. تمام. بإن احنا بنحط البادز ويكون الشيست دراي تمام كويس. بنحط واحدة على الابر رايت شيست، والتانية تحت الابيكس في الليفت بارت اوف شيست. تمام. وبنوصله وبيبقى كله الاريا عندي كلير، ومفيش مفيش اي هازارد عندي، مفيش اي خطر عندي. تمام. وبقول اول كلير، وبدي الشوك، وبعمل بعدها اناليسيز للريزم، بحل الهارت ريزم عندي، بشوف هل هو محتاج يشتغل عليه تاني CPR ولا يعمل يديله شوك تاني. تمام. فده جهاز الاي دي ببساطه جدا هنشوفه مع بعض في الفيديو. يلا بينا.
There's no pulse. 1, 2, 3, 4.
Remember,
5, 6,
push hard
7,
and fast,
9,
at least
10,
2 inches or
11,
5
12,
centimeters.
13, 14,
His chest
15,
needs to
16,
completely
17,
recoil
18,
after each
19,
compression.
21, 22, 23, 24, 25, 26, 27, 28.
Analyzing
Everybody clear?
heart rhythm. Do not touch the patient.
Although AEDs may differ slightly, there are 4 universal steps for operating an AED. First, turn on the AED. Open the carrying case or the top of the AED, then turn the power on. Some devices will power on automatically when you open the lid. The AED will guide you, but it's still critically important that you know these steps. Some AEDs may have adult and pediatric pads. Make sure you use the adult pads on anyone 8 years of age and older. Peel away the backing from the pads. Following the pictures found on the pads, attach the adhesive pads to the victim's bare chest. Place one pad to the side of the left nipple. Place the other pad on the victim's upper right chest directly below the collarbone. If instructed by the AED, clear the victim and analyze the rhythm.
11, 12.
Analyzing heart rhythm. Do not touch the
Analyzing.
patient.
Let's switch.
Shock needed. Charging. Stay clear of patient. Press the
Shock
flashing
advised.
button
Clear.
now.
Be sure that no one is touching the victim, not even the person in charge of giving breaths. Ideally, you will pause CPR during or immediately after a set of compressions. Some AEDs will tell you to push a button to allow the AED to analyze the heart rhythm. Others will do that automatically. The AED may take about 5 to 15 seconds to analyze the rhythm. The AED then tells you if a shock is needed. If the AED recommends a shock, it will tell you to clear the victim and push the shock button. Again, be sure no one is touching the victim to avoid injury to rescuers. Then loudly state a clear the victim message. It can be something like, "Everybody's clear," or simply, "Clear." Perform a visual check to ensure that no one is in contact with the victim.
Shock advised. Clear.
Press the shock button. The shock may produce a sudden contraction of the victim's muscles. As soon as the AED gives the shock, immediately resume CPR, beginning with chest compressions.
11,
Do not remove the AED or turn it off.
17, 18,
The AED will repeat the analyze and shock cycle every 2 minutes.
28.
No shock needed.
When the AED indicates no shock advised, you do not check the pulse first, you immediately start chest compressions again.
6, 7.
There are also some special situations you'll need to consider when using an AED. If a victim has hair on his chest, the hair may prevent the pads from sticking. The AED may tell you to check the pads. If this happens, press the pads down more firmly. If they still aren't sticking, rip the pads off forcefully, removing the chest hair. Then reapply a new set of pads to the bare skin. If your AED supply kit has a razor, you can use this to shave the area as well, and then reapply a new set of pads. Water on the victim's chest could allow the shock to travel through the water between the pads and prevent delivery of an effective shock dose to the victim's heart. If someone is lying in water, you should quickly move the victim to a dry area. If the victim is lying on snow or in a small puddle, you may use the AED. If the chest is covered with water or sweat, wipe the chest before attaching the AED pads, but wipe the chest quickly as it doesn't have to be completely dry. Some people have implanted pacemakers and/or defibrillators in the same place where you would put the AED pads. The device will look like a round or square lump smaller than a deck of cards. If you see this lump, try to avoid putting the pad directly over the lump. Do not place the pad directly over a medicine patch. If the shock delivery will not be delayed, take the patch off and quickly wipe the chest before you put on the pad. We've talked about the differences in compressions and breaths for children and infants, but now let's cover the difference in the use of an AED for an infant or child under 8 years of age. Some AEDs have been modified to deliver different shock doses, one shock dose for adults and one for children under 8. If you use a pediatric-capable AED, there are features that allow it to deliver the child-appropriate shock. Which feature is available depends on the type of AED you are using. If your AED includes a smaller size pad designed for children, use it. If not, use the standard pads, making sure they do not touch or overlap. The important thing is to be familiar with the AED you will be using, if possible, before you actually need to use it. When you are using an AED, remember to turn it on first and follow the prompts as it leads you through the rest of the steps. For infants, a manual defibrillator is preferred to an AED for defibrillation. If a manual defibrillator is not available, an AED equipped with a pediatric dose attenuator is preferred. If neither is available, you may use an AED without a pediatric dose attenuator.
ببساطة معدلة.